What makes safety salient to you as a manager? Is it an event in a related industry? Or in a major hazard industry, an oil spill or a nuclear explosion, for example? Or is it the fear of litigation? And what about slips, trips and falls? Do these cause you sleepless nights and heighten your sensitivity to safety issues? If you work in an environment generally considered to be safe, how do you challenge the possible complacency surrounding safety that results? How do you keep people working safely? These are important questions. IOSH has sponsored a team of Cranfield researchers for 2 years to investigate the leadership of safety in service organisations. Specifically, we're interested in discovering the roles and practices of safety leaders in these environments. For example, what does the shift supervisor do, or the store manager? Do the categories of safety control, safety coaching and safety caring identified in the literature cover the variety of safety practices observed, and does the balance of these categories vary by sector? 4 types of safety leadership have been identified. The monk, who guards the safety manual and hands it down for others to follow. The mercenary, who does safety for you, disempowering the rest of the team. The missionary, who provides lots of safety advice, but doesn't help you put it into practice. Or the mentor, who works alongside others to change safety practices and challenge safety behaviours. Which are you? Secondly, we're interested in knowing how safety practices change over time in response to changes in context, for example, the visit of an inspector or the occurrence of an incident. And how does your response compare to that of a colleague in a different sector? Is the pattern of activities that you perform the same or different to them? Lastly, we wish to know how your social network influences your effectiveness as a safety leader. We know that the quality of your relationships affects whether your colleagues and employees trust and respect you, but their connection to others may exert a still stronger influence upon them. And so these other relationships may greatly influence whether your colleagues take safety measures seriously or not. So, how does this web of social relations and shared values affect the perception of safety and your ability to manage it? We're looking for service sector organisations to join with Aviva, Waitrose and others and engage with us in answering these questions. The HSE publication, Safety Leadership in Major Hazard Industries, has limited traction in the service sector where we believe safety is crucially dependent on effective soft skills. Our aim is to develop a complementary publication focused on these skills in a service environment. Will you help us meet that challenge? If you want more information on the project, would like to participate, or simply want to keep up to date with our progress, then please contact me, Dr. Colin Pilbeam at Cranfield School of Management.